tell us about your patient.
Well, my patient was admitted with pneumonia. He's had a tracheostomy for several years since his neck surgery. He's really weak now. He can't cough up his secretions in his lungs from the pneumonia. So he's been requiring suctioning to remove the secretions from his airway.
Okay, so let's check the order for the frequency and type of suctioning ordered, and we should also make sure to provide pain management if the patient needs it, okay?
Okay,
right.
so I'll get the equipment. Hello, Mr. Swern. How are you doing? This is Melissa, a nursing student, and this is my instructor, Ms. Swinson. They're going to be observing me today. Is that okay? Okay. Sounds like you're having a little bit of trouble breathing, and that can be caused by secretions in your airway. So is it okay if we suction those out? Okay. Let me just check your ID band. Okay. So I'm going to get you into position, okay? Raise your head up. Is it okay? All right. Okay, let me just get this pad across your chest here. Can you just hand me the suction catheter?
There you go.
And we'll make sure it's to the right amount of pressure. Okay, thank you. Okay, I'm just going to get my gear on now.
Melissa, what's next?
You put on your sterile gloves, set up the cup, and then using your non-dominant hand, pour the sterile saline solution into the container.
Right.
Okay, Mr. Swern, I'm going to give you a few extra breaths now. All right, here we go.
Anna, you'll want to keep the resuscitation bag close by for later use, okay?
Okay.
All right, now remember your dominant hand will hold the suction catheter, and that hand must remain sterile during the procedure. Your non-dominant hand is considered clean rather than sterile.
Okay, so I pick up the suction catheter with my gloved, dominant, sterile hand, and I pick up the tubing with my non-dominant gloved hand. I connect the tubing to the suction catheter like so.
Okay. How do we moisten the catheter?
By dipping it into the sterile saline solution.
That's right, and you include the Y port to check for proper suction. The saline should move up the catheter and tubing into the collection canister on the suction unit, all right?
Okay, it's working. Now I remove the oxygen delivery system with my non-dominant unsterile hand.
Now using your sterile hand, you'll insert the catheter quickly but gently, advancing the catheter about 4 to 5 inches, and apply intermittent suction. Rotate the catheter gently while withdrawing it from the trachea.
How long should you suction?
You should limit suction time to a maximum of 10 seconds.
And now I hyperventilate the patient. And I'll use my unsterile hand for that.
Now you'll place the catheter tips into the sterile saline solution and apply suction to flush the catheter. And then you can repeat this procedure as needed to remove additional secretions according to the patient's tolerance.
Okay, and then I allow the patient to rest for at least a minute between suctioning again.
Exactly. And if necessary, replace the oxygen setup during the resting period. Ideally, the suction events should be limited to 3 per session if possible.
You did good, Mr. Swern.
All right.
So can you just turn that off?
Sure.
And I'll disconnect the suction tubing from the catheter.
All right. Let's clean up and get out of our PPE.
Okay. Now I'll put the bed in a comfortable position for you.
Always remember to document what you did, your assessment, and Mr. Swern's reaction.
Okay. So did you need anything? No? Okay. I'm going to put the call bell here just in case you do. Okay? You can give me a call. And I'll check on you a little later on. Okay?
Thank you, Mr. Swern.